The support through IU has been critical. The AMPATH program has been in existence in Western Kenya for 20 or 30 years. The first time I went to Kenya was kind of a fact-finding mission to see what the problems were, and it became fairly clear early on that the inability to make a diagnosis was paramount. Many children would languish on the wards because they had problems that no one had really seen before. They knew they were anemic, they could give them a blood transfusion, they would get better, they'd go home, but they'd come back in a month. And they were missing the fact that that really was a symptom of acute lymphoblastic leukemia or other childhood cancers. And finding kids who had leukemia became a primary focus of my thought process. How do you improve care? Well, first you have to find the patients. Based on the observation of kids not being diagnosed with leukemia, we decided to document that problem for the government to see. And we did that by saying, well, if leukemia exists and it's not being found, how do we find it? In that first visit, I learned how to read malaria slides, and if you look at those white blood cells under the microscope, you can pick out signs of leukemia. So we proposed a study that was ultimately funded to collect malaria slides from a district hospital. We screened the malaria slides collected over a year in that district hospital and performed some genetic tests on those last slides that we thought had signs of leukemia, and proved that about 34 of them had genetic evidence that they had acute lymphoblastic leukemia on the slide, showing that number of kids with leukemia not having a chance to even be diagnosed, let alone begin any kind of treatment. When you have treatment available 50 miles away, the next big question to try to sort out, how do you fix that problem? I think it really comes down to awareness on the part of clinical officers, medical officers, nurses, pediatricians. They need to know that leukemia exists. We'll have case-based teleconferences. People will present cases of kids with anemia or unusual signs or symptoms. They need help with diagnosis, and so we'll use that platform to teach them about leukemia, the things you can do to make a diagnosis, and then how to refer a patient. A second way for teaching is getting involved in medical education and developing an online course that learners can walk through at their own pace. Internet connectivity is relatively robust on smartphones in Kenya, and you can access online learning resources that way. That's how we're going to do the teleconferences. It's also the way that you can do online courses. So that's one of the ways that we're hoping to improve care. Opportunities for students and residents to assist with these kinds of projects in the Kenyan care system are actually quite abundant. We've had fellows in our program focused on a global health project as their fellowship project. We've had a pediatric resident who's joined in on a research project and presented her work on Hodgkin lymphoma at an international oncology meeting. We have a large amount of detail in our databases and tracking systems in Kenya, so that we have a large amount of clinical data that's able to be mined for research projects for students and residents. Anyone who has an interest can join in those types of projects, and I think it's a very wide open field for looking at projects like that.